Now we have discussed the anatomy of the anterior aspect of the wrist and the palm of the hand, and that also brings us to very important structures, which are the nerve and the vascular structures, which I'm going to talk about in this part of the lecture, which we're going to talk about the uh, cutaneous nerve supply of the palm of the hand, as well as the palmar carpal arc, the superficial palmar arc, and the deep palmar arc, which are actually arterial supply for the palmar aspect of the hand. So talking about the sensory nerve supply, the sensory nerve supply of the upper extremity is majorly by the three nerves, which is the median, radial and ulnar, other than the axillary and the musculocutaneous nerves, but they are not present at the level of the hand. So talking about the hand, we have the radial nerve, the median nerve, and the ulnar nerve. And more specifically talking about the palmar aspect of the hand, we have the ulnar nerve and the median nerve majorly. So here we have the palmar aspect of the hand, and here you can see that the lateral 3.5 fingers is actually supplied by the median nerve, and the medial 1.5 finger is supplied by the ulnar nerve. So that is why if there is a person who has a carpal tunnel syndrome, as we already discussed, that would cause the compression of the median nerve, and that person would have symptoms in the lateral 3.5 fingers. Similarly, if someone has a cervical radiculopathy and it involves the nerve roots of the median nerve, that person may also have the symptoms in the lateral 3.5 fingers. Similarly, if there is a person in which ulnar nerve is involved, then there would be symptoms on the medial 1.5 fingers. But in terms of carpal tunnel syndrome, the medial 1.5 finger would be spared from the neurological symptoms such as numbness, paresthesia, pain, and weakness. Now, talking about the blood supply or the arterial supply of the hand. So, first of all, we have the palmar carpal arch. So, palmar carpal arch is made from the combination of the two arteries, which are actually the palmar carpal branch of the radial artery and the palmar carpal branch of the ulnar artery, as we can see here. So, this is the ulnar artery and the radial artery, and the palmar carpal branch of both of these arteries actually meet up in the center to form the palmar carpal arc. Now, palmar carpal arc is joined by the anterior interosseous artery from the above, as well as the recurrent branches from the deep palmar arch, which we are going to talk in the next slides. So this is the superficial palmar arch, this is the deep palmar arch, and this is the palmar carpal arch. So artery, which is known as the deep recurrent branches from the deep palmar arch, they come from the deep palmar arch to join or meet up at the palmar carpal arch, and these are actually the way they are connected with the deep palmar arch. And talking about the forming of the palmar carpal network, which supplies the articulations of the wrist and the carpus. So we can say that the midcarpal joints or the intercarpal joints and the radiocarpal joints, all of these joints are actually supplied by the palmar carpal arch. And if there's a problem at this palmar carpal arch, then the blood supply to these areas will be affected. Now, talking about the palmar arches, we have the superficial palmar arch and the deep palmar arch. So superficial palmar arch is actually majorly formed by the ulnar artery, but it also receives a contribution from the superficial palmar branch of the radial artery. On the other hand, the deep palmar branch is majorly formed by the radial artery. So in some individuals, the contribution from the radial artery even might be absent, and the major, as the contribution is as already mentioned, is by the ulnar artery. However, in the case of the absence of the contribution of the radial artery, then the anastomosis may be formed with the princeps pollicis artery, the radialis indicis artery, or the median artery. But that is in the case of the absence, but still nonetheless the major contribution is by the ulnar artery, as you can see. So this is the ulnar artery, and you can see all of the branches are coming off from the ulnar artery, whereas the radial artery comes and gives off small share to the formation of the superficial palmar arch. Now the superficial palmar arch passes across the palm in a curve with its convexity downward. This is the downward because this is the distal aspect. So here it is the convexity, and here we have the concavity. It may seem like that this is the downward aspect, but this is actually the proximal aspect. So it is the upward and this is the downward. So this is actually the convex part and this is the concave part. Now, moreover, there are three common palmar digital arteries given off by the superficial palmar arch, which arise from the arch and they proceed down on second, third, and fourth lumbrical muscles. Near the level of the metacarpophalangeal joint, each divides into two, as you can see here. The common palmar digital arteries, here, here, and here. On the other hand, it also gives four digital branches which arise from this branch, and this supplies the median or the ulnar 3.5 fingers. So medial or the ulnar, which means these are the 1, 2, 3.5. So these are actually the proper palmar digital arteries which actually supply the medial 3.5 or the ulnar 3.5, not the lateral 1.5, which is the thumb and the index finger. So this 1.5 is not supplied by the superficial palmar arch digital branches. On the other hand, the deep palmar arch is majorly formed by the radial artery, and is another arterial network found in the palmar aspect of the hand, and the terminal part of the radial artery with the small contribution from the ulnar artery forms the deep palmar arch and forms an anastomosis between the radial and the ulnar artery. So it lies upon the basis of the metacarpal bones and the interossea of the hand, and it is located deeper as compared to the superficial palmar arch, and it is covered by the oblique head of the adductor pollicis, flexor tendons of the fingers, and the lumbrical muscles. So that is why it is actually oriented deep. Alongside of it, but running in the opposite direction, we have the deep branch of the ulnar nerve, which is located towards the slightly lateral to the deep palmar arch. So we have the deep branch of the ulnar nerve toward the radial side of the hand, but running parallelly in an opposite direction to the deep palmar arch. So that was all about the nerve and blood supply of the palmar aspect of the hand and the ventral aspect of the wrist. I hope you learned something new out of it, and keep watching sqadia.com for more lectures like this. Thank you very much.